It's Cyber Monday, and we're 50% off.
50% off? 50% off what?
Us. We're Health in 1.0.
I think what you mean is if we're 50% off what the American healthcare system costs, it would be what every other system in the world costs.
God. These jokes are definitely procured at a deep discount. It's Health in 2.0, people. We're digging the bottom of the bargain bin for those jokes there.
You like my witty health policy on the spur of the moment joke?
Yeah.
Oh, well, we'll have to wait for health policy Valentine's to get the really funny ones coming back out later.
Can't wait for that. Only a couple months to go. Did you buy anything for Cyber Monday?
Maybe buying a cheap hotel room in Tokyo.
Oh, I'm buying cheap rain boots for JP Morgan.
It all works out then.
Yeah.
Else we should get on with this episode because the jokes are getting good.
All right, let's do it. Do you have your timer ready?
I have a timer.
All right. Maybe you should get your new phone now.
This one works. I did drop in the toilet yesterday.
Yeah, I know. It's not working.
It still works. There you go.
Oh, here we go. Okay. Outcome Health. Matthew Holt, the FBI choppers, $1 billion scandal. What went?
Oh, it's all good fun. You know, all you'd have to do is you put screens in a wall of a few doctor's offices. You tell drug companies that they're showing ads to millions of patients everywhere. You charge them too much. You lie, cheat, and steal about it. Then you go to a few conferences, tell them how great you are. Not Health 2.0 because Sheila Agarwal didn't come to us. She cancelled. She went to Rock Health. They didn't ask a question about it. And then you tell Goldman Sachs and their friends that it's doing really well and you give me $500 million. It works out fine until the FBI notices a little while later.
Oh, I thought that was just fundraising and health.
Yeah, on the other hand, you stick Goldman Sachs of $500 million, you go to jail. Goldman Sachs sticks the country, $60 billion after the recession with AIG, and they get to keep it and get rich another day.
It's all good. It's all good. Speaking of other secret things, stealth mode. Mint's new company is out of it. So Vital, this is that startup that Mint.com launched. And because,
it's the founder of Mint.com, yeah.
The founder of Mint.com, right? We needed another EHR startup. So tell me about that one.
Yeah, it's an EHR startup that's supposed to work and make it more sensible, and maybe it'll work. But a lot of EHR startups have struggled over the years. I mean, Dr. Krono's still going and a few others. But, it's been hard to break into that market. And it was like tech guy meets brother MD brother for drinks. Maybe an ugly ending in a few years' time when you notice that it's much harder to fix that problem than you hope. But there are a bunch of other people doing that as well. Cue your next question.
Amazon Transcribe Medical. This was big news today.
It is big news, and a lot of people, that Suki, Robin, a bunch of other people are trying to do, voice and nuanced voice-based stuff. But now there's a big dog competitor in that.
All right, Wellframe. Speaking of,
let's got it in there. Hang on. The alarm's gone, but Wellframe.
Sounding like a beeper from like 1994. Awesome.
It is.
So Wellframe, speaking of, been around for a while. 20 million just raised. What do they do again?
So Wellframe is yet another one of these sort of in the midst of health plans and kind of bigger provider groups, things like population health management with messaging and analytics, whatever. And I got to say, this whole area of who's doing population health and what does it mean, it's very confused. They're not sort of, they haven't really broken out from the crowd. I think they raised about 50 odd million now. They've got some clients. There are a ton of other people in this space who are kind of doing population health management, which can mean trying to stop readmissions. It can mean doing the more kind of Livongo model, getting into the home and managing people. That whole area needs a big sort out because no one really understands what it means and what's going on there. And at some point, I did tell to Jan Oldenburg one point about writing a report on it, and one day we'll get our act together and do it. But for now, they're another company. They've got some money. They're building on clients, and good luck to them. Hopefully they'll sort it out.
Let's put that report on the 2020 action plan, yeah?
2020. Is that like a weird TV show about child molesters? Or is that the other one? Is that Nightline?
That's Nightline.
Which one catches the predators as well?
Always Nightline with the predators.
No, I thought it was 2020, but who knows? Anyway.
No, 2020 was...
What is 2020?
Like
is that next year?
I don't think that's even on anymore.
Yeah, I'm actually, that is an area which I'm hoping to do next year. So in December 2020, no, not the Predator. Get the Predator thing out. The population health management, who the hell is doing what and what does it all mean bit, because it's very complex and no one understands it. So hopefully I mean to do this with Jen and we'll see if we actually get it. All right, together and do it. Maybe.
Good. That sounds like a great idea.
We should. It sounds like another great thing I should do. I was going to write a novel last year. That didn't happen.
What did you about? How to Catch a Predator? Oh my God.
Okay, what are you doing this year? Next year?
Next year.
I'm doing something this year. Can I tell you?
Yes. What are you doing?
I'm going to Tokyo. Health 2.0 Japan is next Monday and Tuesday. Those of you in Tokyo, please come join me and a bunch of my favorite people.
How exciting. I'm going to the American Society of Hospital Pharmacies mid-year meeting in beautiful Las Vegas.
Well, there you go. That sounds great. It's a hospital pharmacy. That's actually a big deal.
Yeah. No, that's like a huge part of the business. I know nothing about it. I'm going to go and figure it out and talk to some people and do some WTF health interviews and bring back knowledge.
Very good. All right. Before we go, we should say one last thing about our friends at GuideWell. They have what's happening quick.
Okay, so GuideWell has their Aging in Place Accelerator that is launching, and the applications are due December 8th. So if you're a startup with a solution that could help seniors age in place, GuideWell is a very great company to work for because it is part of the family of companies that also includes Blue Cross Blue Shield of Florida, where there is a very captive market of old people.
Are you trying to tell me all the old people in the world live in Florida? Pretty
well, most of them do. So it's like a super strong business down there. And so you, as a startup, can be allied with that company and launching your solution in that market.
If you get your application.
There's a lot of ifs, always. But
and they choose you, and then. But yeah.
Well, check it out. So GuideWell is the name of the company, and the program is the Aging in Place Accelerator. So you can find that.
All right, good stuff. So I'm going to Tokyo. You're going to Vegas. We'll probably see each other some point after that.
Do another Health in 2.0 at the most inconvenient time for you and the most convenient time for me.
All right, we'll find out. In the middle of the night in Tokyo, we'll do one.
Sounds good. All right. I'm Jessica DeMassa. That's Matthew Holt. You can follow us on Twitter. I'm at Jess DeMassa. He's at BoltyBoy. And of course, subscribe to the Healthcare Blog's e-newsletter in order to receive, there it is, thehealthcareblog.com, in order to receive these episodes of Health in 2.0 right in your inbox, along with some of the other great content that is coming out of the blog on health policy and patient advocacy and all those more exciting topics than this.
There's more excitement than this?
I don't know. We started with espionage and then it just degraded. All right. Enough of this. Matthew, always a pleasure.
See you, Jess.
See you guys. Thanks for watching.